So if anyone thought that COVID was behind us, the last few weeks and some new numbers tell a very different story. Daily COVID numbers, about 26% from the previous week, are up. And according to the Centers for Disease Control and Prevention, about 1/3 of Americans now live in high-risk areas. But there's also a new weapon to help children battle COVID. CBS medical contributor Dr. David Agus is with us this morning for more. Let's start, before we get to the kids, with those higher transmission numbers. We're seeing them up in certain areas since last week. What's that sort of indication as to what may be ahead? And are masks still the best way to prevent that spread?
Well, Dana, numbers obviously are going up across the country. And given that there's less testing, you have to take those numbers almost with a grain of salt. They are dramatically higher. We are at a significant rush of cases all around the country with this new Omicron variant. And I think that's important. At the same time, hospitalizations are going up, but not that much, which is a good sign, and that reflects the immunity and the vaccines that have been working.
Right. And again, is it masking? Is that still a best option?
No question about it. You go to a crowded place, you should wear a mask, period. It's not going to be a mask mandate, but please care about others. We're one community. Wear that mask, stop spread to others. It's a no-brainer.
You say we're not going back into lockdown, and that's an important part of this, right? We're not, more than 2 years?
You've got that look in your face. We're not going back.
I mean, because I remember very clearly when you first came on, when you said the world is changing, is going to change 2 years ago. And some of us were like, come on. And it did. And it has for 2 years plus. So what stage do you think we are at in the pandemic right now?
You know, we're going to live with the virus, right? We're going to accept that we're all going to get it. There's going to be every 6 months cadence, you're going to stay home from work for 7 to 10 days when you get the virus. If we keep our vaccines and our boosters up, our immunity up, it's going to be very mild and it's not going to be a big issue. And the people who are high risk will take pills or a shot that will block the virus so they won't be hospitalized. And so this is a new normal. And the new normal is living with rather than hiding from the virus.
And Dr. Agus, what about Paxlovid? Do you recommend that anyone infected with COVID take it, but are there any risks involved in that?
So Paxlovid is a remarkable drug. You know, the virus is not alive. It gets into our cell and uses our machinery to divide, and this blocks that. The good of Paxlovid is it decreases hospitalization by 90+%. It's pretty dramatic. The bad of Paxlovid now is that it interacts with a lot of medicines. You got to make sure that nothing you're on interacts with it. And in some people, when they stop taking it, a few days later, you get a surge in the virus again. Mild, but it's real and you're infectious again. And it probably means we haven't done the right dose or we need a longer course. We're still learning how to use it, but it is a very good drug.
Parents are still waiting for some good news when it comes to vaccinations for kids under 5. But right now, kids 5 to 11, Pfizer has had their shot recommended for a booster. Do you recommend that for kids?
It's kind of, again, a no-brainer in that regard. You get a dramatic increase in immunity, and the virus is changing. It's not that the vaccines aren't working well. The virus is changing. So get that increased immunity, keep your child protected, and then hopefully in mid-June, the younger will be a vaccine for them.
Now, this is the part where you don't tell us we're going to go into a new lockdown for 2 years and the world is going to change forever when I ask you about monkeypox and what this means.
He's got this serious voice, and I'm like...
I've got it again.
He knows
because I'm prepared now for what you might say.
We're ready to walk off the set if you say our life is changing.
Monkeypox is a cousin of smallpox. It's spread by rats and then, goes to humans. And normally it's not that infectious like smallpox is. But it's got a significant mortality rate. There's been 20 cases in the UK. There's a case in Boston. It looks like there's a case here in New York now. So there's probably a new version that is spreading. It does not seem to be a major issue. The smallpox vaccine does protect against it. We stopped using it in the 70s, but there is a supply of it. So I think it's something we're watching. It's not something that I'm majorly concerned with at the present time, which is going to probably get me in trouble.
We've heard this before.
But I think we have to, we have treatments for it also. But I think we just have to be aware of it. And, we'll get more data from the CDC and other countries over the next couple of weeks. Literally, the first case was just sequenced. So we're going to learn more as we go.
Dr. David Agus, thank you very much for joining us.